I'm here with Dr. Jingli Ma, and today we're going to talk a little bit about asthma.
Asthma is very common chronic inflammatory airway disease, can affect anyone, and they're characterized by recurrent wheezing, cough, and chest tightness. And most people have shortness of breath during the time.
What are some of the environmental factors involved with asthma?
Irritants like smoking and mold, carpets in the house, dog, cats are a very common trigger for asthma attack. And also medications can trigger asthma attack too, like NSAIDs, aspirin. I see a lot of patients have asthma attack triggered by pollens, rockways, trees outside. So what we can do is to prevent those triggers, and people can use some inhalers prior to going outside.
How does someone prevent asthma?
So firstly is to avoid the triggers. If they can't really avoid triggers, they need to take some medications like respiratory inhalers even before they're going outside. And also, depending on the severity of asthma, they need to take the basic inhalers they need to take before they go outside.
So should people with asthma exercise?
Definitely. Actually, it's recommended to do exercise for patients with asthma. The only thing they need to do is to take some inhalers 10 to 15 minutes before they do exercising, and they'll see the difference. Unfortunately, asthma is not curable, but we know the mechanism. We know how to avoid the asthma attack. So if you feel like you do have asthma attack, it's better to talk to your doctor and for some advice.
What's the treatment strategy for someone with asthma?
We have to frequently monitor the symptoms and the lung function. The second important thing is patients need to know the plan and when to take the medications and how often they need to take the medications. The third very important factor is to avoid the triggers like we discussed before.
Have there been some new advances as far as treating asthma?
It's really recommended to use inhalers with correct techniques. Like it's recommended to use air chamber with the medications so the patient can absorb more medication after 1 to 2 puffs of those inhalers.